My name's Dr. Bob McMurtry. I'm a medical doctor and an orthopedic surgeon by background. I've been interested in the problem of adverse health effects in industrial wind turbines for more than 8 years. I have spent something in the order of 10,000 hours researching the subject and now have been sworn in as an expert on the matter of adverse health effects on more than 6 occasions. I've also testified before a committee in the Ontario Legislature, as well as to the Senate inquiry in Australia. I have presented at international meetings and I have published peer-reviewed papers on the subject of adverse health effects in the environs of industrial wind turbines. What I want to say, loud and clear, is the adverse health effects are real. People are genuinely suffering as a consequence of living in the environs of industrial wind turbines. Those who would defend the practice of placing turbines too close to people will argue that it's merely a nocebo effect. That is to say that the people are imagining the adverse events and they see the turbines, and as a consequence they begin to feel ill. The principal problems are sleep interruption and distress, two very important issues, certainly risk factors for significant chronic disease. The argument, however, does not hold water. It doesn't hold water because adverse events have been recorded in at least 6 species of animals that have been exposed to wind turbines. Geese, for example, were placed near and far from turbines, and there was a significant difference in their growth and development. Horses in Portugal were found to have deformities as a consequence of exposure. Preverbal children don't experience nocebo effects. I have known of a child directly that went to an emergency department on 10 occasions simply because of ear pain. Lying coming awake at night, screaming with a discomfort. And each trip, no abnormality was found. The child had ceased having pain, but as soon as the child returned home, the problem recurred. It was only until that family moved into a motel away from the turbines that the problem ceased. There are other stories, such as a blind boy of 8 being driven near the turbines, and within a few kilometers, he said to his parents, "What's wrong? Something's wrong." They could hear nothing and they could see nothing, and of course he never sees. And what he was experiencing was the adverse effects. He started to cover his ears and he asked to be driven away. This has been known since 1985 that there are adverse health effects. It has been confirmed by a number of studies, but to date, no substantial action has been taken by government to monitor the problem. What we have is something that needs to be addressed by government. To do anything less than to visit the homes, to do a physiological or proper health monitoring of people when they're exposed, and to simultaneously record the noise and see what the signals are that are causing the problem. It's hard to describe this behavior as being anything approaching responsible government. In short, we have a problem. There are other options that ought to be considered for the greenhouse gas problem.